That first week, everything suddenly changed. Overnight, something changed.
It was going into the unknown. It's the only way I can explain it is going into the unknown.
They absolutely have been amazing, resilient.
I think you've just done amazingly well.
When the chips are down, you got to actually step up.
People have needed care at home. Nothing's changed with that. Their job didn't stop. They couldn't just turn off.
People tend to forget their fears when they walk into a service user's house because you know, don't you, that you have a duty of care to that person and you have to go in.
This is our family. We do provide good care because we are passionate about it.
We all have experienced it. We all are in it together.
And they knew it had to be done, just like the NHS and everybody. If we stop, who does it? I love the carers, all of them, even the naughty ones.
What we were most concerned about, and I think what everybody was most concerned about with COVID, was that the NHS would become overwhelmed and that our other care settings then wouldn't cope.
Actually, as it happened, the NHS trusts and the hospitals coped extremely well. However, probably one of the biggest hits was in the community, and it was our colleagues in the care homes that were really seeing and really struggling and taking the majority of the weight, actually, in a load of cases.
Our care homes had actually locked down very early on, so they were not taking visitors and we were not going out to visit in person unless it was absolutely essential. And it was really, really challenging.
The first thing you have to bear in mind is that we have a lot of care homes in Sutton. Out of all the London boroughs, we've got the second highest number of care homes. I mean, it's been amazing what they've done in terms of really stepping up to the plate.
My role before COVID, I think, was peaceful. Of course, when COVID came along, it was pretty scary, it was daunting, especially for the carers. Some of them are youngsters with children.
Fear of going into people's houses, because although we know the service users, we don't know their families, we don't know who's been visiting them.
Who had it? Who's got it? If your colleague that's sitting next to you in the car has got it. We didn't know, because there wasn't even any testing at the time. So we just got on with it. We just had to, it was like a game of Russian roulette. You hit and hope. I'm one of the lucky ones, let's put it that way.
So I think our main priority has and always will be for our residents to be protected from any risks, especially due to COVID-19, but also to remain happy and healthy here. Again, for families, some of them were shielding themselves to protect themselves or other people in their household, and not being able to see their loved ones is really hard for them, and it's hard for us as well to kind of limit that contact between our residents and their families.
The great positive thing about this was we suddenly started thinking about people who do caring, and we've taken it for granted because all of us, if we're lucky enough to live to be old, are going to need some help at some point in our lives, and we're going to need someone to help us live our lives.
I think going forward, we hope that the care sector continues to receive the recognition and the funding that it requires in order to do its job to the best of its ability.
Caring is innate, it's in you. You can't teach somebody to care.
So you've got to have a passion for it.
I love it when I go in to see some of them because their little smiley faces makes your day. Yeah, it's not hard to be what we are.
We treat them and look after them as if we would look after our own parents.
Whether you're dom care, you're paid, you're in a care home, I think you've just done amazingly well. You cannot quantify the role and the jobs that you've done.
Thank you from me for everything that you've done.
You're putting yourselves on the front line.
Be proud of what you've done.
People who work in care homes, people who work in home care and domiciliary care.
They went above and beyond.
The most important thing to say is thank you.
So thank you.
I want to say thank you.
It makes our community the special place it is for all of us.